Good morning. Today is Saturday, October 21st, 2023. So let's do a little sound check first. Check, check, check. Sound check. Okay. I think sound is all good. So let's start our program. As you know, this is a Saturday morning class which we've been doing for a long time. It used to be in person, but during pandemic it became your online, and now we're continuing online. So thank you, Linda. The sound is good. Today's topic is again a request, and the request is meditation for cardiac disease. And this is a request from a physician friend of mine who wants to do a meditation. So I explained to him that we go for the steps and stages, and explained to him that meditation is a part of yoga. The yoga is a philosophy. It's called Yoga Sutra of Patanjali, 196 sutras or small aphorisms, of which 193 to quiet down your mind. And if you can quiet down your mind, you quiet down your heart. If you quiet down your heart, you take care of the heart diseases. The heart disease today is due to the hyperactivity from sympathetic overdrive. It is the stress, it is the activation of the limbic system of the brain. And the therapy is parasympathetic activation. The practice is the 8 limbs. In Sanskrit called yam, social restraint, niyam, personal restraint, asana, external and internal alignment, pranayama, voluntary control of your breathing, pratyahara, control of your 5 senses, dharan is the focus, dhyan is the meditation. So the 7th limb is the meditation. And meditation leads to your 8th limb called samadhi. So meditation is a part of yoga, 7th limb of yoga. So meditation is yoga. You know, we use the term yoga and meditation. No, you can say yoga, asana and meditation. And we also say meditation is the medication. Our mind is able to produce every medicine we take, especially the medicine we see in the market now. All the neurotransmitter blockers, all the blockers of your immune system activating agents like interleukin, tumor necrosis factors, all of them can be produced by your mind. So that's what we call meditation is medication. The difference, if you look at a spelling difference, meditation has a T and medication has a C. It's a T for transformation and C for choices. And both the words came from the Latin word medere. Medere means to heal. Medere means to heal, and medicos, M-E-D-I, so medicos. Medicos is the physician. So the root word of the both meditation and medication is same from the Latin words. So I told him, okay, for meditation you have to go through the steps. You have to first prepare your physical body with asana. And asana is a relaxation response. Asana is called the Sthiram Sukham Asanam. stillness, happiness, and in a proper posture. So if you have a fasciculation, if your muscles are twitching, your mind is not going to be quiet. If you feel any discomfort in a posture, in an asana, your mind is not going to be quiet. Sthiram sukham asanam. Breathing has to be effortless. Exhalation longer than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. Then you slowly transform yourself from pranayama to pratyahara, to the fifth limb, to dharan, the focus, and finally to meditation. Once you enter the meditation, you are going to produce aspirin, statin, beta blocker, ACE inhibitor, all the medications you need for your underlying cardiac disease. But my friend, physician friend, he came, yes, I went to a couple of nice meditation sessions given by very famous physicians in this country, and they said, I can take you to meditation in 5 minutes. Okay, so said, let's go ahead and start. So explaining to him what meditation is. Our mind has a thought process. We generate a thought process. We generate thousands and thousands of thought processes daily. Most of our thought process is in the past. Oh, what I have done, what should have done, all this stuff. Another was majority is in the future, what can happen. Very little in the present. Recall, past is a history. Future is a mystery. Present is the gift you take. That's the present. Even in the present, we have the thought process, of which a majority of thought process are called repeat thought process. I have to come, I have to talk to you, I have to present a meditation, I have to present a different type of meditation, I have to present a meditation for my cardiac disease. It's completely chattering. It's called chitta vritti, chattering of your mind. In a meditation, you enter in between the thought process, which is called a gap. And slowly and slowly you practice, you increase the gap. So you are not thought free, which people say, oh, close your eyes, see, what is coming. In meditation, thoughts are like a cloud. The clouds will come, clouds will go. Clouds are still there. So you are making this gap bigger and bigger. So all of your thought process gets into file in a folder. Yes, I have to come here, I have to come here at 9:30. I have my watch with me, and these watches are my health tracker. We do all the yoga practices with this watch to have a health tracker. So the mind quiets down. When the mind quiets down, you get a activation of your parasympathetic output, release of your nitric oxide, which is a potent vasodilator, which gives you the endothelial health. Endothelial health today is the therapy for your cardiac diseases. Underlying all coronary artery disease, atrial fibrillation, you can name it, all the cardiac diseases. So, let's think about in yogic perspective. The mind in yoga is described as a content of your 5 senses. We have 5 senses. We hear, we see, we smell, we taste, and we touch. So if you can tame the 5 senses, which is the 5th limb of yoga called pratyahara. Pratya means reject, ahara means your input. You don't only eat, input, all the eat, everything you hear, you see, you smell, you taste and touch, all are your inputs. And also for me, even I'm talking to you, I am in a parasympathetic activation. My mouth is wet. I have a lot of saliva in my mouth. When you have a saliva in your mouth, that means you have a parasympathetic activation. When you get a sympathetic activation, the mouth gets dry. So, when the content of your five senses is your mind, and these contents get processed, it becomes your intellect, buddhi, called Vijnanamaya Kosha. From mind called Manomaya Kosha to Vijnanamaya Kosha. And then when they get processed, it becomes your wisdom. Anandamaya Kosha. So Annamaya Kosha is your physical body, Pranamaya Kosha is your breath, Manomaya Kosha is your mind, Vijnanamaya Kosha is your intellect, and Anandamaya Kosha is your... At the level of Anandamaya Kosha, we are all in balance. Body, mind and spirit is in balance, and there is no disease. In the Vijnanamaya Kosha and intellect, imbalance starts to happen, but body's intellect says don't do it. So it doesn't happen. It's all in your mind. Monomaya Kosha, all the disease starts. The mind is the root cause of all of our non-communicable disease, NCDs, which you call endogenous disease. This is coming from inside. We all talk about genetics, we talk about all this stuff. It's all we are created. I am the cause and I am the cure. And the proof is here. Your health tracker. Your health tracker is telling you what is going on with you the whole day. Okay, so the first practices for cardiac diseases. The first meditation is to quiet down your mind. So quieting down your mind, there is a lot of process which we do. You close your eyes, keep your spine straight, use your hand mudras, because hand connects between your body and mind. We'll do like this before I can say anything. I will do this before I say, give it to me. So when you do the hand mudras, which I have a whole different practices, mind quiets down. So use your meditation. This is called Dhyana Mudra or a Jnana Mudra. This is the meditation mudra. There are a lot of mudras which we'll talk about a little later. So first is called a guided meditation. Very important for cardiac people. So sit down with your spine straight, like I'm sitting in a chair called a kneeling chair, kneeling stool. All of you have seen before. Or I can sit in a chair with my spine straight. My hands are in a Dhyana Mudra. My eyes are closed. First, I visualize 5 objects around me. Pay attention to those 5 objects. I start here. I'm hearing a sound of all the 5 objects. Every living, non-living creature produces a sound, which is a vibration. Visualize now 4 objects out of 5. And look more carefully at all those 4 objects. Look at every lines, every furrows, every ups and downs, every different color of that. Visualize the 4 objects. Now bring it down to 3 objects. See if you can smell. If you can smell the 3 objects. Smell the fragrance of the three objects around you. Take your time. Now visualize two objects. Have a taste of the two objects. See how they taste. Finally, the one object, touch the object. Keep your hands on the object. Keep it as long as you can. You'll be totally controlling your five senses with this guided meditation, and keep doing it. And in the meantime, you can check your heart rate, check your blood pressure, check your oxygen saturation. You will see the immediate effect of meditation on your cardiovascular system, which will be reflected in your health tracker devices. Focus meditation. Eyes closed, spine straight, mind quite down. You focus. Most important focus is your breath. Visualize your breath. Visualize your breath coming in through your nostril. Your nose is a filter. It is filtering the outside air. The nose is your personal air conditioner. If outside air is cold, it's going to warm it up. If outside air is warm, it's going to cool it down. Air is going on the side of your turbinates. It's like a groove, like a channel. It creates a vortex. That vortex goes over the mucous membrane of your sinuses. It secretes a substance called nitric oxide from your nasal mucosa. Nitric oxide is a potent vasodilator. It opens up the blood vessels. Nitric oxide is a mediator of your parasympathetic tone. Parasympathetic tone is also mediated through acetylcholine, cyclic GMP. Vasodilatation improves your endothelial function. It brings your endothelial health back. Endothelial health today is your total health. Visualize your air coming behind your throat, coming to the upper part of the lung, middle part of the lung, lower part of the lung. It comes almost to the level of your belly button. The breath stops on its own, and you also may try practicing. It's called a Keval Kumbhak. Visualize breath is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, through your nose. The breath is coming out as an exhalation, and the exhalation is longer than your inhalation. Outside your nose, the breath is picking up your life force, prana. Prana is not your breath. Prana is in subtle energy. Keeps us awake, alert, and alive. Metaphorically, prana is the electricity and breath is your electric cable. In yogic tradition, our whole body does breathing. Bring your prana inside. Our skin is breathing, our liver is breathing, our kidneys are breathing. So bring that prana to the organ of healing. For me, I need it in my heart. You have a back pain, visualize prana is coming to your back. It's called pranic healing, pranic energizing technique. Prana, health, prana, teja and ojas. Prana is flowing, there is no blockage in the nadis. Teja is glowing. And oja is forming, there are more ojas. Focus meditation. You can also do an alternate nostril breathing without closing your nostril. Bring your awareness to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. I can clearly visualize I'm breathing in through right nostril. Breathing out through the left nostril. Keep doing it. When the mind quiets down, when mind enters into meditation, you will be able to do alternate nostril breathing without closing your nostril. Left nostril is activated by the right brain, which is intuitive, parasympathetic, cooling, female. Right nostril is controlled by the left brain, which is analytical, male, sympathetic, heating. It balances both sides of the brain, activates both sides of the brain. You also can do a visualized meditation. Close your eyes, keep your spine straight and visualize there is a flame of candle in front of you. It's called Tratak, Jyoti Tratak. Or close your eyes and visualize you're in front of maybe an ocean, looking at the blue water, or looking at a blue sky, looking at the tip of a mountain. Visual imagery. Focus in chanting. You can chant the sound of Om. The sound of Om has the same frequency as the frequency of your brain. When two frequencies interacts, it's a normal physics, it causes called a harmonic resonance. The mind quiets down. Just continuously you can do Om chanting like this. Or you can do a pranabho pranayam. Pranabho pranayam is Om has a three component. A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. This mudra, when your hand is up, is called your Dhyana mudra or a Jnana mudra. When the hand is down, it's called a Chin mudra. It opens the lower part of the lung. If you close your other fingers, it is called a Chinmay mudra. It opens the middle part of your lung. And if you do a mudra like your baby, called Balo Mushti mudra, put your thumb inside and close. This is also called a Adhi mudra. It opens the upper part of the lung. So we'll do a A with a Chin mudra, U with a Chinmay mudra, and Ma with a Adhi mudra, and with a proper sequence. It is called a Pranabho Pranayama. Chin mudra. Ah. Breathe out first. Deep breath in. Another deep breath in. Adhi mudra. You can feel all over the body and mind. This follows with pumping and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth of your hand, it is a very powerful, calming and relaxing technique. If you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes. Relax your eyes. Eyes is supplied by a large number of cranial nerves. Eye is extension of your brain. Main nerve from your retina goes called optic nerve, cranial nerve. Oculomotor ganglion supplies the eyes. We call it SO4 LR6. The muscle superior oblique is supplied by the fourth cranial nerve. Lateral rectus, LR, supplied by the sixth cranial nerve. Eyes are also supplied by the fifth cranial nerve, trigeminal nerve. When your ciliary muscles are relaxed, the convexity of your lens becomes more. It acts like you're reading glasses. You don't need a glass. Massage your forehead. All the muscles here are attached to your skin. When the muscles are relaxed, all the lines, all the frowning goes away. Same in your face. All the muscles are attached to your skin. All your wrinkle goes away. Your skin looks shiny. People say, what did you do to your skin? Take your hand, massage your earlobe, behind your ear, in front of your ear, inside your external auditory canal. It's a branch of the vagus nerve called auricular branch. It is a vagal activation. It's parasympathetic activation. Bring your hand here, massage your carotid sinuses. Carotid sinus is supplied by a glossopharyngeal nerve, the hearing nerve, which essentially goes to brainstem for outflow through your vagus nerve. It quiets down your cardiovascular system, nervous system. We use carotid sinus massage for your supraventricular tachycardia, when your heart rate really goes very fast. Take your hand, massage behind to the tubercle, where there is a two muscles, the accessory muscle and sternomastoid muscle, which are all supplied by the cranial nerve. By the time you do this and look at your parameters. If you look at your parameters, you will see your first of all heart rate, then you will see your blood pressure, oxygen saturation, all of them you will be able to see it here very clearly. It's a wonderful the monitor for your all the work you are doing. Another meditation for the heart disease is called a mindfulness meditation. Mindfulness meditation means you put your mind every actions you are doing. Here I am. I'm talking to you. I'm in a Facebook Live. This is my mind. My mind is here. My mind is not anywhere else. My five senses, even I can use one sense at a time. When I see, look at you, I just use my vision and shut down my other senses. Reading a newspaper, that's your meditation. You're cooking, that's your meditation. All the actions you do is called a mindfulness meditation. Very, very important. So I still have a lot of saliva in my mouth. That's a very good sign. People ask me, why don't you take any medication? You have all the cardiac problems. I have it for 22 years back. So I said, I'm always in a state of parasympathetic activation. The practices I do, it creates your baroreceptor sensitivity, chemoreceptor sensitivity. It acts like your beta blockers. It acts like your ACE inhibitor. The vasodilation, releasing your peripheral resistance. Pranayama improves your preload. More blood will coming into the heart. And relaxation response, releases your peripheral resistance, reduces afterload. Increase in the preload, reduction in the afterload is the improving function, cardiac function. Mindfulness meditation. Movement meditation. Wherever you are walking, put your mind in the walk. And especially movement meditation is very important for people with the kapha type. See the body type, vata, pitta and kapha. Vata is mobile and kapha is very grounding. So if you put them in a kapha, in a mat for your meditation, they will fall asleep. And you put a vata into the mat, they will be always turning, tossing, open, closing your eyes. So you have to put a vata, put into the mat to balance, and kapha to get it. So the kapha moving meditation, we do it anytime. It's called your Kati Chakra Asana, West rotation meditation. The way we do it, the hands in front, close our eyes and coordinate with our breath. Breathe out first. Take a slow, long breath in. Breathing out, slowly turn your body all the way to the back. And in the same breathing cycle, you come back in the middle. Eyes are closed. Your mind is totally in between these two hands and your breath. Same way, breathe out first. Take a deep breath in. Breathe out all the way to the back. So continue doing this, the eyes closed with your breath. This will guide you. This is called your moving meditation. So you go by the step by step and look at your cardiac performance here in your health tracker. Relaxation meditation. We do it many times after practice. We call it instant relaxation technique. Lay down in the mat, you take a deep breath in, then you contract all the muscles. Contract your calf muscles, thigh muscles, hip, back muscles, abdomen, chest, abdomen. Let go. Instant relaxation technique, a wonderful relaxation experience. And you also can do your quick relaxation technique, and it's called a deep relaxation technique. Deep relaxation technique is sometimes called it Yog Nidra. In Yog Nidra, deep relaxation technique, you do the Yog Nidra, and in the Yog Nidra, you enter from all the 8 limbs of the yoga and enter into your samadhi, the 8 limbs. Samadhi is the union of your body, mind and spirit. We don't need to go up to the samadhi. We stay in meditation. As I said, in that state of meditation, mind is producing all the medications you need, and you are, I'm the cause and I'm the cure. Loving meditation is absolutely important. I have a cardiologist friend, after he retired, who was a cardiologist, he was a very gung-ho, all Western trained physician. Now he is one of the most spiritual person, and he understood the spiritual philosophy and the physiological changes of the mind over body. As I said, mind is like a software, body is a hardware. His observation, he said, when I'm playing with my grandchildren, it is the activation of my parasympathetic tone. Loving meditation. You're loving your dog, you have a cat, you have a pet in your home. It's amazing that your loving pet can read your mind, not even your body. You have a dog as a pet. You come home from your work, something happened to your work, you are not happy, or your mind, something happened to mind, they will figure it out without even you telling them anything. They will diagnose any disease you have. You get all a CAT scan, they're a better scan than a CAT scan. You know why? Because our exhale breath has a volatile substance, and every disease we have emits a volatile substance. And the dog's sense of smell, they can smell those volatile substance and diagnose the underlying disease you have. So loving meditation is very important. Spiritual meditation is all your religious practices you do. You do fasting. You do called roza, namaz. Do five times a day in Islam. And if you look at the namaz is quieting down your mind. All these poses, I have done so much of work with them, is that Islam is a powerful yoga practice. Every one in the namaz is one of the named asanas. Patho-asana, vajrasana. Going to the church, meditation. Going to the temple, going to the synagogue. Why? It's a support system. When you're alone, your mind is chattering. When you are together, you have a support system. Mind quiets down. Sufis, Kabbalahs. So it's a wonderful spiritual practice. So, quieting down your mind. One of the best meditation practice in yoga, especially in yoga therapy, is called your chakra balancing meditation. It's really a whole practice, whole session. I think I will do it one day, but just give you a brief overview of the chakra balancing meditation. Let's go over to the chakras. The chakras, say in yogic anatomy, we have first three bodies: gross body, sthula sharir, subtle body, sukha sharir, and causal body, karana sharir. They're connected to the body, mind, and spirit. We have 5 sheaths around us called koshas. Annamaya kosha, physical body, is wrapped around with your pranamaya kosha, your breath, physiology. That is wrapped around with the manomaya kosha, your mind. And explained at the beginning, manomaya kosha, when it became mature, it becomes your intellect. Vijnanamaya kosha, then when it became its wisdom, it's anandamaya kosha. Then you have 7 chakras. Chakras are the spiritual energy, spiritual center at the level of spine, from head to the root of the spine. So when they close their eyes, our yogis and rishis saw the color. If you close your eyes and stay in a meditative phase for some time, you'll see the burst of color, many a time, color of your rainbow. 7 colors. Rainbow colors are Vibgyu, violet, indigo blue, green, yellow, orange, red. They assign those color in a junction where the 2 channels crosses, called nadis, called Ida and Pingala, which originates in your root of your spine and comes through your nostril. Ida comes through your left nostril, Pingala comes through your right nostril. So along the line of the spine, there are 7 colors and 7 wheels, the chakras, which are not in balance. And this imbalance in the wheels causes the root cause of the disease. And these chakras are also connected with your different systems of your body, and the balancing the chakras are going to create your chakra balancing meditation. So for example, you start at the root. At the root of the spine, it is called your Muladhara chakra or a root chakra. Red in color, 4 petals, is connected to your musculoskeletal system. There is also mudras, bandhas, asanas, pranayamas, which also balances those chakras, which we'll do it in a separate session one day. But there is a sound, the sound which ends with ma. Ma is the sound which quiets down your mind. So the 7 chakras are the 7 sounds. Lam, Vam, Ram, Yam, Ham, Sham, Om. The 7 sounds quiets down your mind. So we'll do the sound balancing chakra balance today, and another day we'll do the chakra balances through your asana, pranayam, mudras and bandhas. So the second chakra, which is in between the belly button and the root of the spine, called Shadhisthana chakra or your pelvic chakra, connects with your respiratory system. Connected to your genital system, gonads, testes or ovaries. It balances with a sound called a Vam. So if you have your pelvic organ issues, we balance these chakras. Generally we do all the 7 chakras, but we do more focused on that chakra. Third chakra is a Manipur chakra at the level of your belly button. Oh, the other color was the orange, and the color was this, 6 petals. So all the colors are the same sequence as the color of your rainbow. Manipur chakra, color is yellow, and is connected with your gastrointestinal system. So all the functional disorders are being balanced with the balance in the Manipur chakra. The 10 petals and balance with a sound called Ram. Lam, Vam, Ram. 4th chakra, which is your cardiac Anahata chakra, connects to the cardiovascular disease. So for all cardiac disease, you try to balance the Anahata chakra, heart chakra. Color is green, 12 petals. The sound is Yam. Come to the throat chakra, Vishuddha chakra. Color is blue. 16 petals connected to respiratory system. Function is the communication. So any respiratory disease will balance this chakra. 6th one is in between your eyes, called your third eye. Connected with your endocrine system. Arga chakra. Arga chakra, color is indigo. There are 2 petals. For all endocrine disorders, connect with this. And these are also all connected with your nervous plexuses, endocrine organs. Finally, at the root, top of your head, Sahasra Chakra. Color is violet, 1,000 petals connected to your nervous system. So let's do the sound and let's finish with your sound balancing chakra, balancing meditation, which is the therapeutic meditation in yoga therapy. All other meditations we say are all effective, good. And if you remember, if you say in sequential orders, we do a guided meditation, which was quieting down the 5 senses. We picked up 5 objects, then we do the 5 senses. We do the focus meditation, which is focusing on your breath, focusing on your alternate nostril breathing, focusing on a visual imagery, your what we did, a flame, like a tratak, sitting in front of an ocean, blue water, blue sky, all the focus meditation. Chanting Om meditation, chanting Pranaho Pranayam, A U Ma. A mindfulness meditation, movement meditation, loving meditation, spiritual meditation, spiritual practice, and a chakra awakening meditation. Sit down with your spine straight. So different chakras, because of their opening, you can use a different mudras also. Spine straight, eyes closed. Bring your attention to the root of the spine. Touch your ring finger and thumb. This is your Prithvi Mudra. This is your earth element. The root chakra, Mooladhara chakra, is connected to your earth element. It also connects your musculoskeletal system, red in color, has 4 petals. The sound to balance is your lung. So breathe out first. Deep breath in. Coughing during all the practices, pranayamas, are essentially normal because your air is flowing through your larynx. That's a very good sign. So if you have a musculoskeletal problem, knee pain, hip pain, back pain, I do a little bit more balancing on these chakras, but also continue the rest of the balancing chakras. I don't just end up with balancing only one chakra. Bring your awareness between the belly button and the root of the spine in the pelvis. Pelvic chakra, Svadhisthana chakra, connected to your gynecological systems. It is orange in color, 6 petals. Sound to balance it is your Vam, Vilacta victory. And the mudra will be your, because this component is water, you do your Varun mudra, touching your little finger and thumb. Breathe out first. Deep breath in. For gynecological problem, we'll do a little bit more on this chakra. Bring your awareness to belly button. Solar plexus chakra, Manipur chakra, connected to gastrointestinal system. Element is fire and is a digestion pattern to a Pachan mudra. Middle finger, ring finger and thumb. Put it over your knees. It's a wheel, yellow in color, 10 petals, and the sound to balance is rum, or like Robert. Breathe out first. Take a deep breath in. Bring your awareness towards your heart. Heart chakra, Anahata chakra. Green in color, connected to cardiovascular system. So for the cardiac disease, you will do more on this chakra, but also you have to do rest of the chakras. See, whole yoga practice is holistic, it's not reductionist. Component is the air. So do your Vayu mudra. Ring finger down and also index finger down, Vayu mudra. Sound here is yam. Well, like yellow, yam. Breathe out first. Deep breath in. Yum. So for all cardiac diseases, you will balance this chakra, Anahata chakra. Bring your awareness to your throat, Vishuddha chakra. Color is blue, 16 petals, connected to respiratory system. Sound to balance this chakra is a hum. H like in Harry, hum. Breathe out first. Deep breath in. Bring your awareness to your third eye. This was the element of space, so the mudra will be your connecting your space with the Shunya mudra, middle finger and thumb. Bring your awareness to your third eye. Aga chakra, color is indigo. 2 petals connected to your endocrine system. Sound to balance this chakra is your sham. It is connected through your mind, so balance to your mind, you do your dhanu mudra or gyanu mudra. Touch your index finger and thumb. Breathe out first. Deep breath in. This quiets down your whole body. Your whole body vibration comes down. Bring your awareness to your crown chakra, Sahasra chakra. Color is violet, 1000 petals. Connected to nervous system. Sound here is a Om, A, U, Ma. Breathe out first. Deep breath in. Put your hands together in front of your heart. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. It's a Padma Mudra. It connects your body, mind and spirit. It creates the balance. Health is a self-healing. Bring your Padma Mudra towards your heart. This heart is the side of the soul. This is the healing of your heart. This is the meditation for your cardiac diseases. The practice gives you both physical wellness, mental wellness, and spiritual wellness. Both mental and spiritual wellness cause the healing. Bring your hands in front of your heart chakra. Slowly bow your head down. Then finish with the practice called Namaste. I honor the divinity within you. You are divine, I'm divine. And I have generated my parasympathetic activation. Still look at me. I still have a lot of saliva in my mouth after talking to you for so long. I have not touched a single water. What a wonderful practice. So, send me some comments, questions, and I'll be glad to present any other request you have. This was a request from a physician, and I'm going to share. This will be uploaded to YouTube, and I'm going to share to the physician if he has not seen this Facebook Live. I have to go week by week, say every Saturday what I have. If I'm in town, as you know, I'm here. If not, I'll make an announcement in the Facebook page. Thank you for your participation. See you next Saturday.